정리 한번 들었어요.
Hi everyone. 안녕하세요. 닥터제인 구독자 여러분. 오늘은 제가 외국에 계시는 그 외국인들을 대상으로 영어로 조금 어설프지만 마운자로와 문자인 GLP-1 아고니스트에 대해서 좀 설명드리고자 해서 혹시 들어오셔서 깜짝 놀라실까봐 미리 말씀드릴게요. So, hi everyone. I'm Dr. JM. I'm a family medicine doctor from Seoul, South Korea. So you guys know that South Korea is famous of K-pop, right? So I'm a doctor for their country. So this is actually one of my first live streaming in English. So please understand my English very poor, but I hope that you guys understand my practical experience for the patient who use Munjaro or Wegovy. So I would like to share my experience to you guys out of South Korea. So and also I heard about that you cannot see your doctor frequently because it's high cost and then it's hard to beat your family doctor frequently. So I would like to let you know about the side effect on how does you control your Munjaro dose and how you control your side effect with your Munjaro, and then I let you know about that kind of thing. But here's the thing that I'm not your family medicine doctor. I'm not your physician, so it's just information to help your body weight loss, to have your good health. So don't hesitate to ask me some question about your health or health program. Okay, so. For many years, I've been treating patients with obesity and metabolic problems, so hypertension, diabetic, repeat disorder, and everything. So I'm a primary physician to care about that kind of thing, that and protect them to go to the third and high hospital to treat their cardiovascular disease or cancer as well. So I have a responsibility to protect them to have that kind of deep disease. So more actually, I've treated many patients using GLP-1 based medications, including Munjaro and Wegovy. So you guys usually in this day, many of the people who are overweighted use GLP-1 agonist like Munjaro. So today I want to talk about something I see almost every day in my clinic. So every day, my clinic, I usually meet my patient who use Munjaro and Wegovy as well. So why do some people lose weight but why the other struggling with the GLP medication? Because you use the same doses with your friend, but your friend can losing your weight a lot, but you just losing your muscle weight, and then you usually struggle with them, and then but you don't have any tool to ask about that kind of thing. So I let you know about this. Because obesity is not simple about willpower, right? So for a long time, people were told that let eat less and more exercise, and that is the best way to lose your weight. But it's false. It's not true. So it's because obesity is metabolic disease and the chronic metabolic disease. So it's not just eat less and exercise more. So you need to understand your whole metabolic, your body system. More complicated than you thought. So you need to follow your physician by instruction and medication as well. So hormone, insulin resistance, and appetite regulation, sleep, stress, muscle, and genetics, and your food habit, your exercise habit, everything is affect your obesity and your metabolic imbalance. So it is not just only using the GLP-1 Munjaro. Then you need to know about that kind of thing with your physician. So obesity is not simply a failure of willpower, right? So Munjaro Wegovy has changed obesity treatment very dramatically. So if you don't use the Munjaro or Wegovy and before you treated this kind of things, then you should watch these videos, and then it's better to use Munjaro to lose your weight. I often meet patients who say that, Doctor, I'm taking Munjaro, but I'm not losing enough fat. Or I lost a lot of weight, but I also lost my muscle. So I'm so tired. I have constipation. My hair is loose. And this is very common concern in my clinic. So that is the side effect. So even though Munjaro can affect losing your weight, but the other side, you have another health problem like that kind of thing. So you should check up your side effect with your Munjaro, even though you have more efficacy than other friends or other patients, you have to check up your side effects as well. So the goal is not simply to make the number on the scale go down. So it's not depend on your fat mass. It's not depend on your simple number. Not it's important. The goal should be lose fat. So it is very important to use before you using GLP agonist Munjaro. I think that it would be very long time. I think it's getting very nice medication is going out from down day. And so I think most of the people who have metabolic syndrome use the GLP-1 agonist or the other medication, which is about to going out to medical market. So lose fat. You should keep in mind that lose fat and preserve muscle is very important thing to use GLP agonist, not just calorie, right? So that is very important goal. So if you start to use Munjaro 2.5 milligram, and then some patients ask me then, even though I use the 2.5 milligram Munjaro, but I cannot control my appetite at all, but it's not depend on your appetite thinking about your efficacy. It's because the Munjaro GLP-1 agonist can work in your body to lowering your insulin resistance. So you should understand what is the insulin resistance. So you can check up my previous video, and then you can understand the insulin resistance. But simply explain about that, then insulin resistance is, even though you eat less, your fat is going higher and higher. It means that Dr. JM, I don't eat a lot of food, but every day, every week, I got my weight a lot. So I'm so struggling to lose my weight, even though I not eat anything. So it means that you have a high insulin resistance. You can find the insulin resistance in AI, ChatGPT, and anything too, and then you can understand the insulin resistance as well. Because I'm not good with English, so I would like to explain it to you. I would like to explain it to you in English very detailed, but I'm not good in English. So please research. Please find the insulin resistance to metabolic syndrome, and then you can understand the insulin resistance. So if you have changed your food habit, you should choose the food to eat can down insulin resistance level. It means that you control your refined carbohydrate every year with your Munjaro treatment. So it is play an important role to glucose metabolism, because Munjaro is not just control appetite and medication, it is a glucose control medication as well. So even though you cannot control your appetite, it works in your body, invisible. So that that decided to your dose depend on your appetite. You should decide the dose depend on your fat loss. So if you, even though you don't control your appetite with 2.5 milligram Munjaro, but if you change your fat mass every week, every month, and then it affects. So you should decide the effect those depend on your fat losing rate, right? Okay. So, and also second, and you should check your side effect as well. Even though your fat mass is going down every week, every month, but if you have some trouble with gut symptom like nausea, vomiting, or constipation, or diarrhea, or general weakness, or fever, or sleep disorder, and then you should check up the side effect. Even though you have a good effect from the Munjaro to your body weight, it's because what is the reason to use a GLP-1 or Munjaro or Wegovy for you? And it's because for your whole health, right? So it's not for your scale or score or your body weight score, right? So if you have a side effect, you should stop or you should decrease doses from one side by side. You don't understand? So I'm hard to explain that kind of thing, but I think you can understand that side effect is more important than the effect to your weight. So a patient who use 2.5 Munjaro, she didn't control her appetite at all, but after 1 month later, I checked her fat mass, and then her fat mass is decreased about 3 kilograms. So it means that Munjaro can affect to her, and so you should change your bad food habit during treatment of the Munjaro GLP-1 agonist. So it's because metabolic disease. So the first one is refined carbohydrate should cut on your on your dinner or lunch table. So it's because glucose metabolism. So you can eat a lot of fat, you can eat a lot of protein, and not just a calorie. You can eat a lot of meat, pork, chicken, but you should limit it to eat the refined carbohydrate. It's because refined carbohydrate make insulin resistance higher, and then Munjaro cannot affect to your fat to lose your weight. So during the use of GLP-1 agonist, the first important thing is to reduce refined carbohydrate in your table. It is very hard because fruits and bread. So what else? Noodles and pizza or anything with by carbohydrate. But that is not good for your health with your Munjaro. So if you eat that kind of thing with using Munjaro, and then you cannot losing your fat mass. But even though you can control your appetite by it, so you can change your body weight, but it can't affect to your fat mass. But the most important goal to use a GLP agonist is that losing fat mass. So losing fat mass means that insulin resistance level is going down. And it means that your body metabolism balance is going well. And it means that your microinflammation status and microinflammation environment is getting better. And then it means that you can reduce your cardiovascular disease and cancer risk. So that is the most important goal in using Munjaro and Wegovy as well, right? So the other things, and the other, and also I told about that side effect before. So I told you about my experience of my patient in my clinic about the side effect. Firstly, nausea. Nausea is because of GI motility. Because Munjaro and GLP-1 can affect the GI and gut problems because they make your GI movement slowly, and then you feel nausea and vomit, and sometimes you can constipation. But it's not that affect your health. But if you have a trouble to have a eat or have a meet other person to use this to get this side effect, and then you should talk about with your physician, or you can go to the CVS and then you can find GI motility motility drugs. So and you can take it when you feel the nausea and vomiting or constipations. But in paper, according to the paper, and the side effect is gonna be better than by 1 week and like 2 weeks. So if you can control your that symptom, and then you just waiting for 1 week or 2 weeks, but it make you trouble your life, and then you should take a medication. But that is not affect the medication effect. So don't worry about that. So some patients ask me that if I eat the GI motility drugs and then I eat a lot of things because the GI motility is very well, and so is it okay to affect the Munjaro to my weight loss? Don't worry about that. According to the paper, that depend on the side effect. Just depend on the insulin resistance and food habit effect outcomes. So don't worry about that. The second thing is fatigue and general weakness. I think the some patient, I think the who use the Munjaro about for 3 or 4 months or longer, and then you feel fatigue and general weakness. I think it's because the reason is 3 things. I think that's because first one is your calorie is decreased than before, right? Because Munjaro can control your appetite about 20% or 30% than other medications. So you can control your appetite, and so your calorie is down, and then your sodium and anything of the mineral is lower than before, and then that make you feel fatigue and sometimes a hypertension. So if also static hypertension. So you should try to drink a lot of water when you feel that that. And second one is I think the second reason of the fatigue or general weakness of patient with Munjaro is that absorption of GI tract is decreases, micronutrition. And so micronutrition is very important thing to make ATP, so energy metabolism. So, but the energy metabolism, it needs micronutrition from our gut, right? So, but the Munjaro or GLP-1 agonist can control your GI motility. So decreasing your GI motility, and then the micronutrition is getting lost or absorption in your gut. and that means that you can control your energy metabolism by them, because of them. So you should take a supplement, or you should take some micronutrition when you use Munjaro or Wegovy. It's because depend on the gut environment, one by one, case by case. But some of my patients who were not good with the gut environment usually have that kind of symptom of fatigue and general weaknesses, because Munjaro make their GI motility decreases, and that means that the slower motility and the less micronutrients absorbed. So it is very important thing. It is very important thing. And also, if you have some trouble, both of the side effect, GI side effect, and also fatigue or general weakness, energy metabolism, and then you should take probiotics. It seems tell you that your GI environment is not good than other patients who are not who are not have that kind of side effect. So it is very important recognize that. So your gut is not good if you have a side effect right now. And also, Dr. JM, will I regain the weight when I stop Munjaro? That is where most of my patients worry about that kind of things, because they success will lose, and they successfully lose by Munjaro for 1 year or 6 months during 6 months by instruction of my treatment. But they always worried about that. Is it possible? Is it impossible to maintain my weight, or is it? I'm just worrying about that. I am going back to my weight, so I couldn't stop my Munjaro at all. So how long do I have to use the Munjaro? And then I'm scared about that. So the answer is weight regain happen. Weight regain can be happen, right? So it's aging metabolism. So fat mass increase is that the aging process. So we couldn't block the aging process, right? But we can control how much the weight regain during 1 year or 5 years. It's so because when the medication remove the appetite and the insulin resistance, the decreasing that kind of biological signal were being controlled by the medication can change again. So that means that you should control your food habit during using GLP-1 agonist or something medication. So even though that especially Munjaro, most of the medication which is control body weight can regain their weight. So it is not depend on GLP-1 or not. So the most important target is a fat mass, and for men, you should check your fat mass rate 25%, and for women, you can you should target your fat mass weight about 28 or 30% in body, and then it is more easier. It is if you achieve that goal in fat mass ratio, and then it is not that easy to regain your weight. It's because under 25% is your fat is most of your fat are brown fat and not white fat. So I'm going to tell about the kind of things of fat. What is the difference between brown and white fat? But today it is very long story, so let me tell you about that kind of thing next time. So finally, I summarize it by live stream shortly. So because I am not good enough my English, but I hope you can understand my meaning to use your Munjaro, and I hope I hope to help your health about that. So three things to take your home. The first one is Munjaro GLP-1 agonist medication is not the control appetite medication. It's control metabolic environment by decreasing insulin resistance. Okay. And second, if you have a side effect, nausea, vomiting, constipation, fatigue, hair loss, and anything else, and then you should check up the side effect with your physician who prescribe the medication. And if you can control the side effect by yourself, and then just keep the day by day to get better than before, but the side effect is going to be worse, and then you should stop or beat your physician before you raise your dose or before you inject next time. Okay. And third one is that the most medication, if you cut the GLP-1 medication, you can regain your weight, right? So it's an aging process, but don't worry about it. During medication or during treatment of GLP-1, you should change your food habit. So without refined carbohydrate and eat more calorie with protein and fat, right? And so you can handle your appetite and you can handle your metabolic situation. So then that makes you that regain your weight after you stopping the Munjaro or GLP-1 agonist. So the goal is not the weight kilogram or pound. Just to point to the goal is the fat mass and fat mass rate. So it is very important thing for your health. And so I closed my live streaming now. I have a lot of video in Korean. I have a lot of video in Korean by YouTube channel, so you can find some other information from that with the subscript in English, but it is because I made it in Korean, so I hope you can understand with the subscript or something write something that. And then 질문이 영어가 진짜 어렵네요. So I closed my live stream. Then it's all done. That I would like to letting you about the Munjaro experience to you guys. And so finally, I start make a medical content in Korean because I want patient to understand actually happen inside. So, but it is very hard to when you know in English. But I hope you have I hope you to have this video to your good health and using GLP-1 agonist. And so I really wish your health in Korea. So if you have any question, don't be hesitated to put the question under the video, and then I will check the question after my clinic time or after some times, and if I have some rest, and then I will answer the question about your concern about your health. Okay, so I hope that my English is getting better next time, but I hope that you can use the video for your health. Bye. 단백질 쉐이크 먹어도 됩니다.
수분함량 최대